Have you ever woken up with, that nagging shoulder pain? Or maybe heard a friend talking about a rotator cuff injury? It's pretty easy to just think, oh, well, it's age, or maybe I pulled something, working out or falling awkwardly. But here's where it gets really interesting. What if something much, much broader, like a really common systemic health issue, is actually playing a big role? Not just in getting the injury in the first place, but also in how well you recover from it.
Exactly. And that's really what we want to dig into in this deep dive. We're going to look closely at the connections, the links between metabolic syndrome, that group of common health conditions, and rotator cuff problems,
Hmm.
both the injuries themselves and, crucially, how people heal after surgery. We're pulling insights from recent scientific reports, trying to extract the key facts, the surprising bits, to help you get really well informed on this. It's a critical link between your overall health and how your body repairs itself.
Right. So it's like looking at how the whole body environment affects what feels like a very specific localized injury in the shoulder.
Hmm.
Okay, let's unpack this a bit then. Before we connect all the dots, maybe we should clarify. What is the rotator cuff exactly? People hear the term all the time, but
Good point. Well, put simply, the rotator cuff isn't just one thing. It's a really vital group of four muscles. You've got the supraspinatus, infraspinatus, subscapularis, and teres minor. They all start on your shoulder blade, the scapula, and they attach to your upper arm bone, the humerus. And together, they're just absolutely essential for most shoulder movements, lifting your arm, rotating it, that kind of thing.
okay, four key muscles working together. And are injuries to this group common?
Oh, yeah, surprisingly common. Rotator cuff tears affect something like 20.7% of the population overall. But what's really fascinating, and maybe a bit counterintuitive, is that a huge chunk of those, about 16.9% of people, actually have a tear without any symptoms.
Wow, really? Walking around with a tear and not knowing it?
Exactly, they're asymptomatic. But generally speaking, the chance of getting these tears definitely goes up with age, mostly due to sort of natural muscle degeneration over the years.
Okay. So if you do have symptoms, what does that usually feel like?
Well, typically it's pain, maybe weakness in the shoulder, and just general difficulty using it properly, shoulder dysfunction. The injury itself can be a whole spectrum, from tendinopathy, which is basically inflammation or irritation of the tendon,
Hmm.
all the way to minor partial tears or even complete full thickness tears of those muscles or tendons.
Got it. Okay, so now let's bring in the other piece. Metabolic syndrome. You mentioned it's a cluster of conditions.
That's right. And it's a really major health issue. Its prevalence is increasing globally. It's not a single disease, but a group of metabolic imbalances that often occur together. We're talking about things like hypertension, high blood pressure, obesity, low levels of HDL cholesterol, that's the good kind, high blood sugar, or hyperglycemia, and hyperlipidemia, which is high fats or lipids in the blood.
When I first started reading about this connection, it was a real eye-opener. It really changes how you think about something like a simple shoulder injury. So this is where it gets really interesting. Let's dive into how these specific parts of metabolic syndrome actually impact your body, especially something like wound healing.
Absolutely. And maybe the place to start is insulin resistance, because it's often seen as a root cause, a big driver for metabolic syndrome developing. When your body becomes resistant to insulin, it struggles to use glucose properly for energy. This leads to more free fatty acids circulating in your blood, which then messes with your cholesterol and triglyceride levels, increases VLDL production. But here's the really crucial part for healing. This whole cascade stimulates downstream inflammatory pathways. So you end up with increased inflammatory markers circulating all the time, things like IL-6, TNF-alpha, C-reactive protein, or CRP. Your body is basically in a constant state of low-grade inflammation.
Wow. So it's like this underlying simmering inflammation that's always there because of the insulin resistance.
Pretty much. And that underlying inflammation is a huge saboteur when it comes to healing efficiently.
Okay, that makes sense. A silent saboteur is a good way to put it. What about hyperglycemia, the high blood sugar component? How does that specifically interfere?
High blood sugar is a problem across the board for healing. Think of wound healing in, say, three main phases: inflammation, proliferation, building new tissue, and remodeling or strengthening. Hyperglycemia messes with all three.
All three. How?
Well, for starters, it makes blood vessels stiffer and narrower, slowing down circulation. That means less oxygen gets to the wound site. It also reduces the ability of your immune cells, your leukocytes, to travel to the wound to fight infection and clean things up. So infection rates go up. Plus, you get things like endothelial dysfunction problems with the lining of your blood vessels, increased reactive oxygen species, which are like cellular exhaust fumes causing damage, and reduced nitric oxide, which is important for blood flow.
It sounds like a traffic jam for the body's repair crews and supplies.
That's a good analogy. And it's important to note that chronic high blood sugar, unlike just a temporary spike, also leads to lower muscular performance over time.
Okay, so impaired healing and weaker muscles. Not a good combo. And then there's obesity, another major part of the syndrome.
Right. Obesity, which we usually define as having a BMI of 30 or more, fundamentally stems from a long-term imbalance where calorie intake exceeds expenditure, leading to increased adipose or fat stores. And this excess fat isn't just inert storage, it actively affects healing. It impairs angiogenesis, the body's ability to form new blood vessels.
So again, problems with getting supplies to the repair site.
Exactly. And like insulin resistance, obesity promotes chronic low-grade inflammation. The fat tissue itself can become poorly oxygenated, which triggers the release of more inflammatory signals and can lead to fibrosis or scarring. And there's something else. Obesity leads to a decrease in adiponectin.
Adiponectin.
Yeah, it's a really important cytokine, a signaling molecule that normally helps with wound healing by stimulating that blood vessel growth and also the growth of skin cells called keratinocytes. So when adiponectin levels drop because of obesity, healing is directly hindered.
It really sounds like a multi-pronged attack on the body's ability to fix itself. Okay, one more component. Hyperlipidemia, the high cholesterol or lipids. How does that specifically hurt something like a tendon?
This is fascinating, actually.
Yeah.
Increased levels of LDL, the bad cholesterol, can lead to fatty deposits called xanthomas forming within the tendons themselves.
Inside the tendon, like plaque in arteries.
Sort of, yeah.
Yep.
These deposits can trigger tissue necrosis, meaning tissue death. It also seems to weaken the connection point where the tendon attaches to the bone, the enthesis. We see this, for example, at the infraspinatus insertion. It impairs how the tendon handles mechanical loads. And what's really striking is how cholesterol accumulation seems to directly interfere with collagen synthesis.
Ah, and collagen is the main building block of tendons, right?
Precisely. So if you disrupt collagen production, you harm the tendon structure and its biomechanical properties, its strength and elasticity. Plus, studies show patients with high cholesterol often have higher levels of those inflammatory cytokines we mentioned earlier, like IL-6, MMPs, which break down tissue, TP53. It's like the body is constantly signaling damage and inflammation within the tendon environment.
Okay, so putting this all together, if someone has metabolic syndrome and needs rotator cuff surgery, what does this generally mean for their outcome?
Well, connecting all those mechanisms to the clinical reality, the findings are pretty clear, unfortunately. Patients who have metabolic syndrome and undergo rotator cuff repair tend to face longer hospital stays after the surgery. They also have a higher chance of the repair failing, experiencing a re-injury or re-tear, and they're more likely to end up being re-hospitalized compared to patients without the syndrome.
That's a pretty significant difference in the recovery trajectory. Can we break that down even further? How do specific things like diabetes or obesity play out after the surgery itself?
Definitely. Let's take diabetes, which is characterized by that hyperglycemia we discussed. Studies show diabetic patients often report more pain after arthroscopic rotator cuff surgery. They also tend to have a much lower range of motion recovery. What's really telling is that their improvement often seems to plateau around the 6-month mark post-surgery.
Whereas non-diabetics keep improving.
Right. Non-diabetics often continue to see improvements for up to a year. And the reasons tie back to what we discussed: impaired healing at the tendon-bone junction, that oxidative stress, and the buildup of those advanced glycation end products, AGs.
The AGs that gum up the collagen.
Exactly. They modify collagen, making it stiffer and less functional, and they also impair bone healing. So this really raises a critical question. How much does this directly contribute to higher re-tear rates, especially when you're dealing with larger tears or when there's already some fatty infiltration in the muscle, which is also more common in these patients?
Okay, that makes sense for diabetes. What about obesity on its own impacting recovery?
Obesity also shows a negative impact. Studies indicate that obese patients often have poorer external rotation and just worse overall shoulder function scores when checked a year after surgery, compared to patients who aren't obese. The repaired shoulder just doesn't seem to work as well long-term.
And hyperlipidemia, you mentioned fatty deposits. Does that translate to worse surgical outcomes too?
Absolutely. And this finding was particularly stark. One analysis found that individuals with hyperlipidemia were 4 times more likely to experience a re-tear after their rotator cuff repair compared to those with normal lipid levels.
4 times?
Yeah. It really underscores how significantly those lipid issues, maybe through those deposits or inflammation, can compromise the healing process and the durability of the surgical repair.
Okay, so given these really significant impacts, it naturally leads to the question, what about treatments for metabolic syndrome, like statins for high cholesterol? Do they help improve rotator cuff repair outcomes, or is it more complicated than that?
That's the logical next question for sure. Statins, as you know, are the main drugs we use to lower lipid levels. They work by blocking an enzyme called HMG-CoA reductase, which is key for the body making cholesterol. Now, when you look at the research on statins and rotator cuff issues, the picture gets, well, murky. It's quite conflicting, actually.
Oh,
Not a clear benefit.
not consistently, no. On one hand, some studies have suggested that less activity of that HMG-CoA reductase enzyme, the one statins block, is linked to a lower chance of having rotator cuff disease in the first place. And some animal studies, in rats, found that statins seem to promote healing pathways.
How so?
They appeared to stimulate something called the KEO-X2-PGE2EP4 pathway, which helped cells involved in healing to differentiate, move, and multiply. This seemed to enhance the biochemical strength where the tendon reattaches to the bone. And then there was one clinical study that found higher cholesterol or LDL levels around the time of surgery were linked to needing revision surgery later on. And in that specific study, patients taking statins had a reduced need for repeat repair. Okay, so that sounds promising, but you said it's conflicting.
Right, because other studies found basically the opposite, or rather, no difference. Several studies looked at hyperlipidemic patients undergoing rotator cuff repair, comparing those who used statins versus those who didn't. And they found no significant differences between the groups in terms of things like how much fatty infiltration developed in the muscle after surgery, overall shoulder function scores, or even the rates of re-tear.
So some studies suggest a benefit, maybe related to initial disease risk or revision rates, while others looking directly at post-op healing find no difference with statin use.
Exactly. It's a mixed bag, which really tells us we need more research, probably more specific research, to truly understand if, when, and how statins might affect rotator cuff healing. It's clearly not a simple take statins heal better equation.
Yeah, definitely sounds like an area needing more clarity. Which kind of leads into the challenges researchers face when studying all this, doesn't it?
It really does. There are quite a few hurdles. One big one, especially with diabetic patients, is just how variable blood glucose levels can be. Trying to constantly monitor those levels, especially around the stressful time of surgery when they can fluctuate a lot, makes it hard to pin down the precise impact of hyperglycemia itself. Another major challenge is just teasing apart all the factors. Metabolic syndrome isn't one thing, right? It's a cluster.
Yeah.
So figuring out the interplay between hypertension, obesity, lipids, glucose, and then factoring in other health problems the patient might have, other comorbidities, it gets really complex to isolate the effect of just one component.
What sort of other factors could muddy the waters, so to speak?
Well, age is a big one. As people get older, their metabolic rate naturally tends to decrease, which can contribute to metabolic syndrome features independently. Smoking is another. We know smoking reduces insulin sensitivity, making metabolic syndrome worse or more likely. And even things like chronic stress can play a role. Stress can lower your HDL, the good cholesterol, and contribute to insulin resistance and weight gain. So all these lifestyle and age-related factors can overlap with and exacerbate metabolic syndrome, making it tough to isolate the syndrome's direct impact on rotator cuff recovery in studies.
That makes sense. Lots of confounding variables.
And there's another layer of complexity, too, the surgery itself. The way the rotator cuff is repaired, whether it's a traditional open surgery, a minimally invasive mini-open approach, or fully arthroscopic surgery done through small keyholes. Each method can have slightly different recovery timelines and outcomes. Generally, arthroscopic repair seems to show better results nowadays, potentially less re-injury risk, maybe less pain, better function restoration. But because the surgical method varies, sometimes based on the tear itself or surgeon preference, it adds another variable that makes it hard to purely isolate the effect of the patient's metabolic status on their recovery across different studies.
Right, so you have patient factors, lifestyle factors, and surgical factors all potentially influencing the outcome. It's definitely complex. So, given all this complexity, where do we go from here? What's on the horizon? Are there exciting new directions being explored to maybe improve things, especially for these patients with metabolic syndrome?
Yeah, there are definitely promising areas being explored. On the drug development side, researchers are looking beyond just managing symptoms. They're investigating ways to target the root causes, like regulating body weight through signals in the brain, targeting specific hypothalamic pathways, or something called the melanocortin system. The idea is to find better ways to help manage obesity and related metabolic issues.
So tackling the systemic problem more directly?
Potentially, yes. And then related more directly to the rotator cuff repair itself, there's a lot of work going into new surgical techniques and adjuncts. Things aimed at decreasing that risk of re-injury and speeding up recovery. This includes things like exploring stem cell therapies to boost healing, or using biological scaffolds or synthetic patches to reinforce the repaired tendon.
Oh, like adding extra support.
Exactly. The hope, at least theoretically, is that these kinds of advanced repair strategies might help overcome some of the healing deficits seen in patients with metabolic syndrome, leading to better, more durable outcomes for them. And thinking even broader, it actually raises another interesting question for future research. Could the whole experience of having a significant injury, going through surgery, and the subsequent recovery period, could that stress on the body actually contribute to the development or worsening of metabolic syndrome later on?
Huh. Like the injury itself could trigger metabolic changes.
It's a possibility worth exploring. We know injury and surgery induce stress responses and inflammation, so understanding if that has long-term metabolic consequences is an interesting avenue.
Wow. Okay, so wrapping this up, this deep dive has really shown, I think, how profoundly metabolic syndrome, through all those components like high blood sugar, high cholesterol, obesity, inflammation, really influences things. It impacts your likelihood of even getting a rotator cuff injury and then significantly affects the whole recovery process if you need surgery. It's definitely not just a simple shoulder problem in isolation.
Absolutely. And maybe that leads us to the final thought we want to leave you with, really understanding this deep, intricate connection between your overall systemic health, your metabolic status, and what seems like a very localized injury, like a rotator cuff tear. It truly underscores just how important a holistic view of health is. So the question becomes, how might this broader perspective on your metabolic health empower you? How might focusing on it help not just your potential musculoskeletal recovery, but maybe other areas of your life and well-being too?